I am Dr. Tevna Tayler. I am a licensed naturopathic physician in the state of Arizona. For those of you who don't know what a licensed naturopathic physician is, it's sort of like being a regular family practice doctor, only a slightly different system of medicine. We go to regular medical school, just like MD and DO doctors do. We take all the same classes, and in Arizona we can also prescribe medications, deliver babies. We can do most things that a regular family practice doctor can do. In addition to that, we have a lot of additional training in herbal medicine, homeopathy, Chinese medicine, mind-body medicine. Basically, our goal is to get people back to their natural state of health in ways that are as safe, natural, comfortable as possible. However, we do use medications and more intense types of regular medicine type therapies when we need to. And some people do need a blend, and some people do need to be on medications in some circumstances. So here at ATMC, we use, part of what we use is a newer branch of medicine called Orthomolecular Medicine, also known nowadays as functional medicine, or you may know it as using supplements to give you nutrition that you need to accomplish different things. So orthomolecular medicine basically uses substances, usually natural substances, minerals, amino acids, vitamins, that sort of thing, just to specifically nourish different parts of your body. Cells get their nourishment from food, but when we use specific supplements, we can get a better effect. We use environmental medicine here, meaning that part of the reason that a lot of people are having different types of health problems is because they have a lot of environmental toxicity. They have a heavy load of burdens from pesticides, non-organic foods, just personal care products, household cleaning products. The environment, breathing in the air nowadays is full of different types of poisons, heavy metals. So part of our program here is focused on helping our residents' bodies remove the excess burden. Now, all of us do remove toxins every day, but sometimes the accumulation of the toxins is too much for our regular kind of cleansing parts of the body that handle that. So we use techniques like sauna here, where we increase the amount of sweating that the body does, exercise, and very specific supplements that encourage the body to release the toxins and then move them out of the body. And when you reduce the burden, then you get better results all around. At Alternative to Med Center, we individualize treatment based on each person. What that means is that every person is very specific. We all have different genetic backgrounds, we have different medications that we might be on, different toxin burdens, different digestive patterns. There are so many ways that people are individual. So here we take that into account when we design the protocols that are best for each individual. And that includes the ways that we help each individual remove environmental toxins, and includes the different supplements that we recommend that they take, and just all around the approach that we take to each person. It's very specific. At Alternative to Med Center, we recognize that one of the reasons that some people are put on psychiatric medications in the first place is actually because of an overload in the body of certain environmental toxins. And one of the most important of those related to brain function is mercury, and to a lesser extent the other heavy metals. So part of our program here is to do what is called chelation, which is to remove heavy metal storage from the body. We use oral chelation currently, which is taking certain supplements that dislodge the heavy metals from the tissues. And then we give additional supplements to help the body completely clear those. My goal for the residents at Alternative to Med Center is that they regain the life that they would like to have. That means different things to different people. Most people come to us hoping to get off their prescription medications, and that certainly is a goal and one that I assist people with when it is appropriate. I think it's important to mention that in some cases people do need to remain on medications because we do not know a natural treatment method sufficient to keep them safe, healthy, and comfortable at this time. But many residents can get off prescription medications and find a natural solution. Other residents come for a broader understanding of how their own mental, emotional, and spiritual patterns affect their lives and how they're responding. And that is a very important part of the transition from a medicated existence to a non-medicated existence. So my goal at the base for everyone who comes in is that they learn how much power each person has over his or her own brain function, so that they can learn tools to effectively live a natural life free from the need of external medications to assist. Again, where appropriate, when that's appropriate.